Welcome back to another deep dive, Today we're going deep on breast trauma.
Oh yeah, common one.
Yeah, definitely a frequent flyer in surgical practice. And you know what? It's a bit of a sneaky one sometimes.
Absolutely.
Can really throw you off.
Yep.
So we're going to focus on two key sequelae of breast trauma: hematoma
Oh.
and traumatic fat necrosis.
Yeah, those two can be real tricky.
They can. And getting a real solid understanding of these conditions, that's crucial for avoiding unnecessary interventions, wouldn't you
Oh,
think?
absolutely. I mean, what seems like a straightforward injury, right,
Right.
can actually mask uh, some pretty big diagnostic challenges. So
Yeah.
it's about keeping that broad differential
Yeah.
and not getting led astray.
That's it. So let's start with hematoma.
Okay.
We all know, right?
Mm-hmm.
A resolving hematoma, it can feel just like a lump on
Oh
examination.
yeah, for sure.
But here's the scenario. I think we've all faced this. A patient comes in, they've got a breast mass, there's no history of significant trauma that they can recall,
Hmm.
and there's no visible bruising.
Right.
So in those cases, differentiating a resolving hematoma from something a bit more, well, sinister,
Yeah,
it can be really nuanced.
it really can. And the thing is, the absence of those superficial signs, the bruising,
Right.
it doesn't rule out the possibility of a deeper hematoma.
That's a good point.
Even those seemingly, minor incidents, like a little bump or something,
Yeah.
can actually cause bleeding within the breast tissue. And then without that visual cue,
Oh,
right?
right.
Palpation alone, I mean, it can be misleading.
It can be, yeah.
Yeah.
So in your experience then, what's the key takeaway when we encounter a breast lump and there's no obvious history of trauma?
Well, I think a detailed history is just absolutely paramount. Even if the patient doesn't, immediately remember an injury, it's important to really probe, ask about any minor bumps, falls, even strenuous activity.
Interesting.
Sometimes those things, they can be revealing. And if there's still some clinical suspicion there, even if the exam seems benign, a biopsy is often the only way to definitively rule out malignancy.
Yeah.
We can't just rely on assumptions in those situations.
No, you're right. Okay, well let's shift gears a little bit now and talk about traumatic fat necrosis.
Sure.
This is another interesting one. It can present in both the acute and the chronic phases. Now,
Mm.
we tend to see this more, I think, in our stout middle-aged patients, wouldn't you say?
Yeah, that is a pretty common observation.
Yeah.
The exact reasons for that, they aren't totally clear yet,
Okay.
but it could be that the greater amount of adipose tissue in that demographic might play a role in how the breast responds to trauma.
Makes sense.
Yeah. So typically, these patients, they'll present with a painless lump
Right.
after some kind of blunt force to the breast.
Right. But this is where things can get really tricky,
Yeah.
diagnostically speaking.
Oh yeah.
Traumatic fat necrosis has this almost uncanny ability to mimic carcinoma. And
Right.
and not just the palpable mass,
Right.
but also it can present with those classic red flags, the
Mhm.
ones that always make us think malignancy, like skin tethering
Yeah.
and even nipple retraction. So why do you think this benign process can present with such concerning
Well, it
signs?
all comes down to the inflammatory response and the subsequent fibrosis. The
Okay.
the injury, it triggers this inflammatory cascade,
Right.
and that leads to fat cell death. Then, as the body, tries to repair that damage,
Mm.
fibrosis starts to occur.
Mm.
And that fibrosis, it can contract and it can distort the surrounding tissue,
Mm.
and that's what leads to those clinical signs that we associate with malignancy.
Ah, okay, I see. So given all of this clinical overlap then, what's the definitive step we need to take in these cases?
Well, in any case of suspected traumatic fat necrosis, a biopsy it's absolutely essential
Okay.
to definitively rule out carcinoma.
Right.
Imaging can be helpful, it can be suggestive, but it's rarely conclusive.
Okay.
So histological examination,
Mm.
that's the gold standard.
Gotcha. And it's important to highlight, I think, that while a history of trauma might make us lean towards fat necrosis,
Hmm.
it's not a guaranteed diagnosis.
Oh, absolutely not. No, the trauma, it could be totally incidental.
Yeah.
The patient could have an underlying, completely unrelated lesion
Yeah.
that was, yeah, just brought to their attention by the injury.
Makes sense.
So we always need to maintain, a degree of suspicion.
For sure, for sure. Okay, so finally, let's talk about high impact trauma, particularly what we see in road traffic accidents. Now, seat belts,
Yeah.
they're crucial for safety, of course. Oh, yeah.
But unfortunately, they can also cause significant breast injuries.
They can, and it's because of those forces involved in rapid deceleration. I mean, they
Yeah.
can lead to surprisingly severe damage to the breast. We can see, complete transection of the breast tissue.
Wow.
Yeah, and even worse in some cases, avulsion,
Right.
where the breast is actually, forcefully detached from the pectoral muscles.
Yeah. These are critical things to be thinking about, I think, in the trauma bay.
Oh, absolutely. I mean, the mechanism of injury,
Right.
that provides crucial context.
Yeah.
And it can really guide, our assessment and our management. It's kind of a stark reminder, really,
Yeah.
that even those, life-saving interventions like seatbelts
Right.
can have unintended consequences, and we need to be aware of them.
We do. We do. So as we've discussed today, what might seem like a straightforward breast injury, it can actually lead to some pretty complex diagnostic scenarios.
So keeping hematoma and traumatic fat necrosis high on your list of differentials in the context of trauma,
Mm-hmm.
and remembering that they have the potential to mimic malignancy.
Yeah,
That is absolutely paramount for optimal patient care.
it really is. And it just highlights how important it is to have a thorough clinical assessment,
Hmm.
a detailed history, and a low threshold for biopsy when there's any diagnostic uncertainty.
Couldn't agree more. That comprehensive approach, I think, is what allows us to really navigate these challenging cases effectively.
Yeah, definitely.
Okay, well, thanks for joining me for another deep dive.
My pleasure.
Thank you for listening to our podcast. See you next episode.